Hello everyone and welcome back to Conversations on the Couch, Season 2. I am very, very excited today. We have Dr. Ben Singh from the University of South Australia with us today. Dr. Ben has a Bachelor of Clinical Exercise Physiology, a Master's degree in Research, a Master and a PhD in the role exercise improves health outcomes among women with breast cancer, and currently he has had a little bit of famous stuff happening with his research on the beneficial effects physical activity has on your mental health. Welcome, Dr. Ben.
Thanks for having me.
No worries. Now, I want to start with a little bit about your background and fitness. Yeah. When you were growing up, was fitness something that you did? Did you play any sports?
Yeah, so I always was involved in some sort of sports from a young age. So sort of footy, playing AFL, and then also I had a father who was in the military, so he was always quite active and always sort of encouraging me to do be active, go for a run, start lifting a bit of weights. So I've always had that interest from a young age. And I think particularly the sports, when you're involved in sports, you at a young age, particularly team-based sports, you get that sense of enjoyment. You're playing with a bunch of guys who are, you get that group environment. And so I think that's had an influence in me in terms of keeping active throughout my life and seeing the benefits of being active as well. And my father now, he's well into his 60s and he's in good shape, still runs around with his grandkids. So I think it's good having that influence as well. So just not for the immediate benefits as well, but also the long-term benefits.
Yeah, great. And so tell me about why you decided to research the physical activity and the effects that actually has on mental health. What was the reasoning behind going, this is what I want to research and find out about?
Yeah, so I think part of it was the personal experience. So just knowing myself that when I do go to the gym in the evenings, the positive mental benefits I get. So it helps me reduce my stress, always gives me a boost in mood. So I think knowing personally the benefits of exercise, but also we've seen as a result of the pandemic this past few years and a bunch of other factors as well, that worldwide there has been increases in the rates of people experiencing mental health symptoms such as depression and anxiety. So there's, particularly in recent times, there's become a real need for trying to develop effective interventions that can help tackle mental health symptoms. And we've known for quite a while that physical activity is beneficial, but we thought that there's so much research out there, it's important to try to summarise that research. So what we thought would be an interesting project was to try to do the most comprehensive review that's ever been done, to try to summarise all the evidence out there on the benefits of physical activity on mental health symptoms.
Okay. And how did you go about that? And look, from a point of view of myself, we have researched a lot at Power to Move about physical activity and how that actually improves the clients that we have. So what was the type of research, and then how did you pull all that together to go, this is what we need to do?
Yeah, so basically what we did is a large systematic review. So basically we tried to review all the existing evidence that's out there. So we search a whole bunch of different online databases which publish a bunch of different studies. And we tried to include as many existing reviews as possible. So we just did a big database online search, got all the articles that assess any type of physical activity, any type of exercise, and assessed either anxiety, depression, or mental health.
Okay.
And we basically, once we got all those reviews, we just summarised all the findings, just using some statistical techniques. So it's a complex approach. It's a bit time consuming, but it's we weren't actually going out and conducting a research in participants ourselves. We were evaluating the existing evidence.
The existing info that was out there. And with that, what were the outcomes? Because obviously you've got your depression, your anxiety, and your mental health. Was there different research for the different areas? Yeah,
so we found out that most of the research has looked at depression, and there's less evidence out there looking at anxiety and distress, so psychological distress. And so it seems like depression, there's a lot more research supporting the evidence in depression, but it's not to say that exercise is less effective for improving anxiety or distress. There's just less evidence there because it's less commonly evaluated.
And so with the depression, what were the findings? What did you find?
Yeah, so basically we found consistent findings for sort of depression, anxiety and distress, but we found out basically any type of physical activity, any type of exercise was beneficial. So there was a wide range of exercises that were evaluated across all the different studies. Most commonly it involved walking, so which is pretty sort of, I guess, something we'd expect because it's easy to assess. Anyone can sort of just walk out their front door and go for a walk.
Yep.
But we found that walking, any type of aerobic exercise was beneficial, resistance exercise, so lifting weights.
Yep.
And also there's a lot of emerging recent evidence showing the benefits of sort of those mind-body exercises such as yoga or Pilates. Okay. So they also were shown to be extremely effective. But basically anything that gets the body moving was shown to be effective.
Yeah. I know from a personal point of view in our gym, we have, and we were talking about this before, 50% of our population are NDIS or have some form of disability. And a lot of those people have mental health, anxiety, stress, depression, and are on medication. And one of the things that we have noticed is over time, it's usually about 6 months as well, where someone is coming to the gym on a regular basis and being part of our community and exercising, they get the opportunity to perhaps reevaluate their medication or reduce their medication. And in some experiences, some of our students have been able to eliminate medication because of physical activity. What do you see in the future in regards to like this area in health and maybe like with GPs? Do you see doctors prescribing walking 30 minutes a day instead of popping a pill, or what would your what would you like to see in this space?
It's I think one of the reasons why exercise is so sort of appealing is because if we think about medications, there's often a lot of short-term side effects, and often the longer-term side effects of medications are unknown, and quite often patients who are taking medications maybe over time need to take more, so they have to increase their dose, and that can lead to sort of various adverse effects. And so whereas exercise on the other hand doesn't really have any side effects. I mean, there's some discomfort, there's a small risk of injury, but there's a whole range of not just mental benefits but physical benefits and long-term health benefits. And so I think it's a difficult to sort of answer directly, because I mean, medications do play an important role for a lot of people, and particularly if you think about someone who's suffering from severe depression, they might struggle to get out of bed in the morning, they might struggle to sort of get up and make themselves breakfast, and they just lack motivation. Yeah. And if you told them to exercise, it would just be the last thing on their mind.
Absolutely.
So medications do play an important role, and I don't think that, I mean, it's a conversation that patients need to have with their GPs, but I think it's not a case of exercise replacing medications, but more so exercise being included in the conversation for coming up with a individualised treatment plan. So maybe for some patients it might mean starting off with a low dose medication and a 30-minute walk, for example, and then over time, like you said, maybe it will reduce the need for that medication so they can slowly come off that medication. But I think if someone's sort of on medications right now for their mental health symptoms or their conditions, that it's not a case of saying I'm going to stop these medications and start exercising. It's really an individual approach that patients need to have with their GPs. But like I said, over time, hopefully we can sort of rely more on exercise for not just managing sort of depression and anxiety, but also reducing the risk of it. So people who aren't experiencing any sort of mental health symptoms, maybe if they keep active, it'll lower their risk in the future. Okay. So prevent the need for even getting on medications in the first place.
That's a really, really good point. And with your research, did you evaluate how much exercise and the type of intensity? Yeah. Like, tell me the findings on that, because I think what we do here, we try and do small bites, especially at the beginning. And, saying when someone is completely depressed and, the doctor, says to them, to eat better or to get out of bed and do some movement, that can be completely debilitating. Yeah. And we have a very different approach here of trying to just, sometimes the first step is just to come to the gym, and that is the first step, and that can be such a big step. And then, maybe the next step is to step inside the gym, and then the next step is maybe to step inside the gym and do something. Yeah. But what is that amount that works?
Yeah, so when we evaluated all the evidence, we found that in terms of the amount that people should be doing each day for optimal benefits, we found that it was about 30 minutes a day led to optimal benefits, and then aiming for more, so for example, doing 60 minutes didn't provide too much additional benefits for mental health symptoms. And I think that's important because 30 minutes is a lot more achievable for a lot of people. And like you said, it doesn't necessarily need to be that someone starts off with 30 minutes every day. It's about building up and doing what they can for that particular day. So going back to that patient who might be experiencing severe depression and they struggle to get out of bed, maybe just starting off with walking to the mailbox and back, or like you said, just sort of coming to the gym, getting familiar with the environment. So ideally, eventually progressing to about 30 minutes a day. We found sort of led to the optimal benefits. And in terms of intensity, we found that basically any intensity, so low, moderate and high, was beneficial. But there tended to be greater effects with greater intensity. So moderate had slightly greater effects, and then high intensity had the greatest effects as well. But like I said, we don't want people getting the wrong message thinking that they have to do high intensity, because low intensity still provides a lot of benefit. And we know for particularly those individuals who might not have any previous exercise history, they've never done anything, just starting off and doing a light walk is the best place to begin. And then over time, we know exercise, it needs to be progressive. So maybe slowly over time, maybe small increments in the intensity or the duration.
Yeah. And those findings would probably align with the WHO, the World Health Organization guidelines for physical activity as well, I would imagine. Yeah,
so that was the really comforting thing about our findings, is they were really consistent with the Australian National Physical Activity Guidelines of aiming for about 150 minutes a week, and the, as you said, the World Health Organization guidelines. So that was quite comforting and quite good, nice to see, because it sort of justified the current national guidelines.
Yeah, absolutely.
And that, like you said, people don't, if 30 minutes a day was sort of the optimal, but they can start by doing maybe 3 10-minute bouts.
That's exactly what I was doing. You just took the words out of my mouth.
So it doesn't have to be sort of that sort of aiming big to start off with, just starting off with small achievable goals, and then, because there's no rush with exercise. Ideally, we want people exercising for the rest of their lives, so they don't need to start doing 150 minutes straight away if it's not feasible for them.
Yeah. So if someone was starting out and they, were at home, like we were talking about, and the thought of actually even getting out of their house was probably too much, breaking down 30 minutes into a couple of 5-minute blocks or 10-minute blocks of walking in their backyard or up and down the driveway is enough to actually start getting them to feel better before they then take that next step of whatever that might look like.
Yeah, definitely. And often if people are finding that they're struggling to motivate themselves on their own, or they really don't know where to begin, then that's where speaking to maybe a health professional or an exercise specialist or a personal trainer, to have someone to sort of guide them and support them and provide that motivation to help them sort of get started. And that accountability as well is important. So it depends on the individual. Some people like exercising on their own. Some people really need someone who's sort of guiding them through every step. So I think it's working at an individual basis to work out what's most effective for that person. Yeah.
Now, I do recall, so we've spoken about the aerobic, the strength-based, resistance-based training, and then obviously the yoga or Pilates type stuff. Is there any research in regards to is strength-based training better for someone that has depression, and yoga for anxiety? I'm not certain, but did you delve into that sort of area?
Yeah, we did. It does sound like you read the paper in detail, so that's good. Yeah, we so basically we found that any type of exercise was effective, but there were some specific benefits. So we found for depression in particular that resistance exercise was the most effective, and for anxiety, yoga and Pilates was the most effective. So we think with the anxiety that the yoga just provides that sort of calming effect that helps to regulate breathing. So people who might be experiencing anxiety or be prone to panic attacks, just being involved in sort of that meditative exercise that helps regulate your breathing can be quite beneficial. But again, we don't want people to get the wrong message to say that depression was most responded best to resistance exercise and yoga was the most effective for anxiety, because we found that basically any type was beneficial. So if someone really enjoys going walking every day, and that's sort of what they enjoy the most, or they exercise in a group, or they're not keen on doing yoga, whatever it might be, we know that in order for people to adhere to exercise for a long term, they need to enjoy it. So it's about finding
100%.
an activity that you enjoy rather than doing exactly what the evidence tells you. Because with these findings, a lot of the effects are based on sort of large samples of individuals. Whereas if you look at each individual on a one-by-one basis, everyone has different interests, different preferences, different personal circumstances. So we really need to take sort of the individual into account.
And sometimes gym culture isn't the right culture if you've never been, if you've never hung out in a place like that. It can be pretty daunting as well. So maybe a walking club or finding someone to go down to the park with is a better thing.
And it doesn't necessarily need to be structured exercise to begin with. We do want that structured exercise so you can monitor your intensity, but even just sort of maybe some sort of some sport or going out for a bike ride, just anything that gets the body moving is a good place to begin. Yeah,
fantastic. Now, I've got to ask you this one. Your research has had like international exposure. It's been seen by millions of people. It's been retweeted. It's been everywhere. And the other day, I saw Joe Rogan, podcaster, spoke about you.
Okay, University of South Australia researchers are calling for exercise to be a mainstay approach for managing depression, as a new study shows that physical activity is 1.5 times more effective than counseling or the leading medications.
I mean, what was that when you found out that, these celebrities, but, Russell Brand, talking about mental health, exercise, and then you get thrown into the mix here. What was that like?
Yeah, it was sort of surreal, but at the same time, when we do research, we don't just want to publish it and have just a handful of researchers read the paper and then never see the light of day again. We do this research because we want it to get out to the public, and so I think that's one of the benefits of sort of social media and doing podcasts like this, is it just gives us that ability to break down the scientific language and present it in a way that is friendly for everyone to sort of understand. So any exposure we can get is definitely good. But yeah, it definitely was a bit surreal and very unexpected as well. Like, I mean, I think one of the reasons why this research got so much attention is because of that sort of need for interventions that address mental health symptoms, because it is becoming quite an issue worldwide. So
yeah, cool. And I'm yet to completely finish watching that Russell Brand and Joe Rogan podcast, but it's fantastic that that's a great platform to get that message out to a lot of different people. What do you think the landscape, or do you think the landscape's going to change in the future in regards to mental health, maybe even at schools as well, in regards to physical activity, yoga, and how that's going to change, in our world moving forward? What would you like to see?
Yeah, so I think firstly there's becoming more awareness around mental health. So particularly in workplaces, for example, I think in the past, if someone has been experiencing depression or anxiety, it's often been difficult to pick up in the workplace. But now I think that because there's more awareness around it, people are starting to take it a bit more seriously and realising that it is a big issue, which I think is good. It's helping people to sort of become aware of the symptoms and maybe take steps to help treat their mental health symptoms. But I guess in terms of physical activity as well, in terms of seeing it included more in sort of practice, so being prescribed by doctors and GPs. So just having exercise included more in the conversation. So if a doctor does have a patient come to them with a mental health condition or any other condition, instead of relying solely on going straight to medications, just also trying to incorporate exercise into that sort of conversation as part of their treatment plan. And I think it's difficult because, as I said, if we go back to that example of someone experiencing severe depression, if the doctor sort of gives them a choice between, you can sort of take these pills a couple of times a day, or you can go for a 30-minute moderate walk, intensity walk, often they're going to go straight to the medication just because it's a lot easier. And if they've never exercised before, or they've got no previous history of being active, then exercise might be quite difficult for them to start with. So I think just sort of identifying the barriers that people with mental health symptoms are experiencing, finding out why they're not exercising, and trying to think about what additional resources or support we can provide them to help them become active.
Yeah, fantastic. And
Yeah.
What do you do for fitness now? I know you mentioned that you go to the gym, but is there anything else that you do?
Yeah, no, so it's just, that's all I really like, is just lifting weights. So it's been quite a while now, I'm just consistently lifting weights. So I've been going to the gym regularly for 15 years. And for me, I just sort of like that sort of, I know everyone likes exercising at different times of the day. There's no real right or wrong, but for me, I always like sort of lifting weights at night. So like finishing all my sort of work and all my responsibilities for the day, and then sort of later at night go to the gym, lift some weights, and always a mix of sort of free weights and machine exercises. I think now that I've been getting a bit older, I've started using a lot more machines. I think they just feel a lot easier on the joints. So I don't know if that's me getting softer as I'm getting older, but for me it's always been lifting weights, not just for the physical benefit, but just sort of the stress relief and the improvement in mood I get as well. And I think because I've been doing it for so long, it's just a structured part of my day. So for me it's just like brushing my toothbrush. It's just sort of, I do it every day.
Just do it every day.
And I think I make sure I sort of structure my day, so I always have time in the evenings to go to the gym. So I very rarely miss workouts, and even if those days where I'm not feeling sort of motivated or I'm feeling a bit fatigued, I still sort of like going to the gym just to keep into that habit. So maybe there's been a few workouts where I just go in and sort of run through the motions, and it's not a very good workout, but at least I know I've achieved something that day.
Do you feel better afterwards though? You know, on those days where we sort of have a bit of a saying here, you know, the days that you don't feel like it are probably the days you need it the most. Where you do get those endorphins going and feeling a bit better.
I think so, because for me, I don't like saying, I'm going to skip a workout and then missing a workout. For me, it's sort of that mental, I don't want to sort of feel like I've sort of failed. I've set myself a goal of going to the gym that day. And even if it wasn't a good workout, then I've still got that sense of accomplishment knowing I've gone.
You've still ticked it off.
And I feel like sometimes for me it can be a slippery slope. So if I do miss one workout, then maybe I'll skip the next day, and then all of a sudden one workout turns into a week of missed workouts. And
very true.
I think another thing is if I miss a workout, then I feel like I can just slack off in other areas. I can maybe just sort of have a few Tim Tams or something. So I think going to the gym just gives me that discipline in other parts of my day. So it's a small investment, so it's 60 minutes, but it helps improve the other sort of 23 hours of my day. So I definitely feel like it's worth it, even on those days I don't feel like exercising.
That's a very important thing. I find that the consistency is one of the biggest things in regards to any type of result, whether it be mental health or physical health. So that's a really important thing. I want to go back to your original research about women with breast cancer and improvement of health, because you made a point off screen before about the social aspect. And I know that in our gym in particular, the social aspect and our community is such an important thing to why people keep coming back and why people keep the consistency. But tell me about the research that you found in regards to women with breast cancer and exercise.
So we found that so in the past, there was always that belief that women with breast cancer, once they've been diagnosed, the best thing for them to do is rest and recover and go through their treatment. And there was actually a lot of people sort of had that belief, particularly GPs, that exercise and activity would sort of exacerbate a lot of their symptoms. But more recently, in the past sort of 20 years or so, there's been a lot of research to show that actually one of the best things they can do is keep active, because it'll help prevent a lot of the symptoms of chemotherapy and other treatments such as surgery as well. It helps improve their quality of life and helps improve their mental health symptoms. So there's a lot of benefits to show that after being diagnosed with breast cancer, that keeping active and doing some exercise helps reduce a lot of the symptoms of chemotherapy and other treatments that they're having, and helps just improve their quality of life. And there's a lot of evidence also to show that, particularly women with breast cancer, that the group-based exercise is the most effective for particularly the mental health symptoms. So if we think about a diagnosis of breast cancer, often it's a difficult time for the patients. So they've just been diagnosed with a life-changing disorder. They've got a lot of severe treatments that they have to go through. And the evidence shows that being in that group environment with a bunch of other individuals who are going through that same experience, you get that sort of sense of community, you get that shared identity, you're exercising together, you're talking about sort of how difficult treatment might be. You're able to you don't sort of have to hide a lot of your side effects or the difficulties that you're going through. You can share all of your experiences, and that's shown to be extremely beneficial for not just the physical benefits and adhering to the exercise, but also the mental health benefits. So it's definitely that sense of community as well. And I think often if you're exercising with a group of people and you're enjoying it, you're having a bit of fun, it takes your mind off the exercise as well. So it makes the exercise a lot more manageable. Yeah. So that's been shown for quite a lot of conditions, that the group-based exercise is quite beneficial.
Yeah. And in taking that then back to the mental health side of things, was there, so we spoke about the yoga, Pilates and strength-based exercise and walking, but has there been any evidence about group-based activity with mental health?
Yeah, a lot of it has been focused on sort of lifting weights. So some of the evidence that we looked at in the review was the group-based exercise was mainly sort of resistance training classes, and that was shown to be quite beneficial. And when we looked at the different populations, we found that those individuals with a range of different medical conditions. So we found that exercise was extremely beneficial for people with HIV, AIDS, kidney disease, breast cancer, and diagnosis of depression and anxiety. So again, it goes back to that sort of scenario where if they're in a group of people who are going through a similar situation as them, then it tends to be quite beneficial for sort of anxiety and depression. And so there was a range of different populations that we looked at in our review, but we also found that people, so healthy adults who didn't have a diagnosis of depression or didn't have a diagnosis of anxiety, that exercise still improved mental health symptoms. So I think we've all experienced weeks where we're have certain days where we might be feeling a bit down, or days where we're feeling a bit anxious or a bit stressed with work. And so even those individuals who don't have a diagnosis, who might be considered sort of otherwise healthy, can still benefit quite a lot mentally in terms of mental health symptoms just by being active. And it goes back to what we were talking about earlier, that can also help long term to help prevent the onset of depression. So there's basically a lot of convincing evidence. I think now all the evidence is out there. It's just about what support can we provide people to get them being active.
So summarising, 30 minutes every day. It doesn't matter what it is. Gentle walking, going for a jog, taking the dog for a walk, lifting some weights, doing some yoga, Pilates, it doesn't matter. And it doesn't have to be done in 30 minutes. We can break it down into smaller, bite-sized pieces to get 150 minutes in a week. Healthy life, healthy mind, healthy body. That's pretty much it.
Yeah, just keep active, just get moving.
That's simple. I think we can all do that. Dr. Ben Singh, thank you so much for being with us today.
It's been a pleasure.
I've enjoyed reading your research. It definitely is something close to my heart and definitely what we do at Power to Move. And congratulations with the Joe Rogan and all the other research and where it has gone worldwide. I look forward to seeing your next bit of research.
Thanks for having me.
Thank you.